Hello, welcome to Hear4Health, your channel for your health. And I am so pleased today in the community health segment of Hear4Health to be able to welcome Judge Michelle Frehette, who is the Municipal Judge of Corrales, New Mexico. We've been busy chatting and I'm still smiling. Michelle, so nice to have you.
Thank you.
I will address Michelle for formal reasons as the Honorable Michelle Freshette, but I will be calling her Michelle during the interview. So, please, what do you think is the biggest issue facing us with law enforcement and community health that could be derived as a part of that?
Finding solutions that are the background to why and how people end up committing crimes is obviously the cornerstone of the big question, from my perspective anyways.
Sure.
After 30 years of working with people, defending criminal cases, and 10 years now on the bench, one of the things that's most evident to me is that the people that are encountering the most crime in their lives are also people who very often have a secondary condition of some sort going on that's unidentified.
Huh.
And in the clients that I talk to on a regular basis, in my private practice, there's more serious crimes that I deal with in terms of my clientele. And in the bench, the crimes are less serious, although the undercurrents can be the same. The prevalence of ADD, ADHD, bipolarism, anxiety, depression. These things are really large components of people's difficulties, their stress, and these are the kinds of things that come out when crimes are committed. And I think unless we start really addressing in a comprehensive way good mental health for everybody, from when you're popped, from when you're little tiny, until you come into adulthood, we're not going to solve all these problems.
Seems like they're legion.
It does seem that way some days.
Yeah.
Yeah.
So you think crime is sort of a manifestation of a lot of emotional issues that may impact normal behavior? What we would consider?
Oh, absolutely. Clients that I talk to, and even people in their Corrales traffic tickets, I hear people tell me on a regular basis that they were experiencing a lot of grief due to a death in the family. They were highly distracted, or they have significant medical issues and they were in a rush to try to manage that. And so they're not paying attention even to the rules of the road. Municipal court is, traffic and petty misdemeanors,
Sure.
but the larger picture of what's happening around them is what's even creating those issues.
So their personal environment is so stressful that they're focused on that perhaps rather than the integrative community, so to speak. Am I hearing you?
Absolutely. Yeah.
Okay. What do you think might actually contribute towards solving that in your experience?
The increase to provide more mental health services in our state is absolutely critical. I think that if we don't, as a community and as a state, really create more mental health resources for people, we're just going to continue to see the dilemmas that we're having.
Sure.
People don't make progress. And the majority of my private clients always do what I suggest in terms of the therapeutic work that they need to do.
Sure.
But that's something that everybody needs to hear, and I don't think we have enough resources out there to make it all happen. Between inpatient and outpatient therapeutic services, we are very thin in this state.
We are. Do you think that's true for this state, or do you think that's true nationally? What do you think is, I'm asking you actually if you feel this might be a symptom of a failing health system, a symptom of a failing health system, or part of, or is this independent?
I think it's probably a symptom also of a larger picture for our nation. I don't think we as a nation do a very good job of identifying early on how mental health ties into our medical situation. And I think every person needs to have the same level of services available to them from when they're very young. And I don't think that our current system, health insurance and otherwise, is doing a very good job of keeping people in services when they need them, and keeping track of people's needs along the way. We don't integrate very well between our primary care doctor and our therapeutic needs or our problems even in the school classrooms, right? We're not connecting the dots over here. There may be behavioral things happening here, but the medical system doesn't have the mental health tied into it to address those for people.
Well, I'm so glad you said that, because one of the interviews I've done fairly recently has been with Dr. Stacy Goldstein, who is a forensic psychologist and a neuropsychologist, and she mentioned, and she focused on ADD and ADHD, and said that she's getting these people as a therapist down the line when they haven't been appropriately diagnosed at an early age, which means that all those intervening years basically were never used to provide services that may or may not correct the behaviors that she's now seeing. So that kind of that duplicates what, or at least emulates what she's saying. So, gosh, are we really saying that maybe there's a way we should incorporate normal, healthy kind of attitudes, behavior, therapy? I'm not sure. At maybe beginning school?
Well, I really think if our school systems had social worker therapeutic people in every school system that were being able to help students get through the process and help their parents identify early on what their struggles are, I think we'd be in a much better place if those services were provided much earlier.
Sure, and help the families too. So because the families are, we tend to think, I think, of the school system, that if there's issues because of funding, personnel, and all the other myriad problems that occur, that we kind of say, well, it's up to the family to really provide this, but the family may be struggling, and frequently struggles are not independent of the child. They are part of the family network.
Absolutely.
And maybe there's no resources. I wonder if there's no resources. You had mentioned earlier that there was a variety of different mental health consortium at 4 different. Could you get into that? Because I don't want to use the wrong words.
Sure. So 9 or 10 years ago, when I first became municipal judge, one of the presentations to our judges was the Association of Counties had a conversation going on 9 or 10 years ago about creating regional mental health centers in the state of New Mexico to help create this focus. And I have not heard anything else as a follow-up to that, which is very disappointing, because it made me very optimistic to think, how wonderful would that be, right? To have these regionalized centers where mental health issues on an intake basis could be really addressed for the various communities that we have, as opposed to sort of the piecemeal way that we currently do it, which is, yes, we have treatment over here for DWI and substance abuse in a state facility down in Las Cruces, one in Albuquerque, one up north, but they're not really integrated into our larger systems. And as a state, there are so many more people that there's not enough beds. There's not enough inpatient beds to help with the substance abuse that people are experiencing. And for those people that don't qualify to necessarily get or can't get into the state-sized system of beds, they need to go find private systems, and those private systems are very expensive, especially if you don't have health insurance.
Well, and it doesn't promise a solution.
Right.
I mean, just speaking from a standpoint of a physician, when I was seeing patients in skilled nursing facilities, if there was a medical indication, they were okay to stay there, and it provided a community network of sorts. Meals were provided, care was provided, someone eventually would answer your bell. Overstressed, understaffed, too much work for the existing people who were just exhausted, but there was something. And I have a feeling, I've always thought, and I could be way off base about this, but it always seemed to me that if it's not going to be provided to you, which clearly financially we don't have the means to measure it, as Dr. Goldstein brought up, we don't have the means to measure it in early stage. Even if we could identify it, would we have a place to send them? And if we don't, if that place has yet to be identified as being possibly worthwhile for actually that person to be able to reintegrate into a normal, healthy society. And if it's that broken, where do we need to focus? And if the only thing we have that I can see is ourselves. I mean, when it comes right down to it. So how do you address that? Can you address that at the point that they're doing a DWI or doing a misdemeanor when they come before you on the bench?
So in terms of the resources to the people that have encountered the criminal case and are trying to manage that, I find that the majority of my private clients are able to find those resources. The people that I see in terms of the Corrales Municipal Bench for the serious traffic violations, DWI and so forth, those people, for the most part, are people of means as well. I'd say the majority of the people coming into the Corrales Municipal Court are middle income people with a home and with a job. And so the challenge, of course, though, is for everyone these days too, is are you making ends meet sufficiently enough that you could take 30 days away from that job to go get into the 28 to 30 day treatment program if you needed it, right? And that's for our more serious offenders important. For those who are in the lower level, first time DWI, reckless driving, substance abuse related offenses, those people have more opportunities to do it on an outpatient basis. Although I have to encourage people, if you don't find a provider right away, start remotely. If there aren't enough therapists available,
Just start.
Right, to get started in your insurance system, start with that remote human being and then move yourself into in-person or whatever else
Sure.
you need that
It's
they might
whatever you
recommend.
can get.
Right, start wherever you can get, because they're also overworked since the pandemic has come along. You know, there are so many more people doing therapeutic work. But I do ask people on a regular basis, even for traffic cases, to please self-evaluate whether or not they need stress management. Even meditation, do a class in meditation or yoga, learn some breathing, get some more exercise.
Focus.
Apply other things, right, that help you to focus while you're behind the wheel of your vehicle and to help remove some of the substance abuse issues that you're experiencing.
Wow. So how effective do you find that advice? There's a reason I'll ask you why I asked that, though. But do you find people go ahead and follow through?
Well, I'd say that the majority of people with minor traffic violations, when I make those recommendations, are grateful. I've had people tell me that they were really happy that they needed to go get a little therapeutic work.
Okay.
I sometimes will ask that they even get a sentence or two from the provider to turn into the court file so that I can make sure that it's actually happening.
Great.
For my private clients, I remind them every phone call we have.
Sure.
And over the course of 6 to 8 months, those people are getting consistent reminders from me. So most all of my clients in my private practice will have already started a therapeutic process before they see the judge in person, which I think works well. Those are people, though, of middle means, so they're not.
And there are impediments.
Yeah, right. The resource issues, obviously, for the
Sure.
people less financially able, are complicated.
The reason I asked about the compliance with this advice, although I think it's from a healthcare perspective, I applaud it. I also know that people sometimes who need help the most are the most resistant to help. I have found in my particular sphere of medical care. And talking specifically about mental health issues and dysfunctional behaviors and that sort of thing. And it's difficult when you're in a dysfunctional situation to be able to extricate yourself from that, to be able to focus on yourself. And that's, if you could do that, then you're halfway, if not more, there.
Right.
So I don't know what you could use as a carrot at the end of the stick to get people started on that. And this is maybe where you're going back to teaching at a young age.
Well, right. Teaching at a young age is one. The court compliance process, when it is a required part of a criminal case, if the individual doesn't do that, they are looking at a potential failure to comply. which can result in a fine or even potentially jail time if you not only fail to comply, but you fail to appear for the hearings related to your failure to comply. It's important, and the judges in our state courts do impose things like the remaining jail time on a battery case or on a DWI can be imposed on people if they do not do the therapeutic work. So there is a stick which is applied at least in the larger criminal cases. For the more minor ones, I know that they haven't had to pay a fine. I'm hoping that they will do the best for themselves because they don't want to have another ticket. They don't want to have to pay the fine. It's still a negative to have to pay fines rather than just being able to go take care of yourself.
Well, and plus there's embedded knowledge and embedded improvement for yourself and some real benefits that occur from doing it yourself. I mean, that's the growth process. And that's growth and maturity for anybody at any age, really, I think. That's interesting. We've gone down another rabbit hole, oddly enough. So let me make sure I'm really clear on were there any areas that you wanted to specifically address before I go down rabbit hole number two?
Well, let me let you kind of proceed. And
okay, cool. So what determines in the judicial field, as when you're on the bench, what determines recognition as a good judge?
Oh, okay. There are so many contexts, in the professional world. Do you have accolades or awards? And I've never really been one to focus on that. I consider success in terms of the work that I do each week on the bench to be if I am progressing through the docket in a way that people can understand what's happening, because this is a very intimidating process. The average person who gets a traffic ticket has probably never experienced a courtroom environment before. And whether we're doing it remotely or in person, they need to completely understand this is the steps of the process and these are my choices that I can make along the way. So I do my best to make sure that everybody understands what's happening and then that I'm giving them enough opportunity to ask questions. I always tell everyone there's no such thing as a bad question because if you don't ask questions, I don't know what you don't know. Sure. And that's really the cornerstone of me helping them work their way through something that's very complicated in their eyes. And it's reasonable because, when you don't confront these things, it's stressful to do a court process. And if they have gotten to the conclusion of the case and they have understood what's happening and they've been able to make a decision, whether to plead on their ticket or whether to have a trial, regardless what the outcome is, are they getting individually that final resolution that they understand why they got there? And that to me is success because that's my role, is to make sure that everybody really understands.
Gets it. Yeah. That's interesting. And then they can make an informed decision. And I certainly have seen you to be very supportive of the people that appear before you. I think you're very fair and you're very clear about what is appropriate and what is best for the community and best for getting things done. Yeah, I do see that. Okay. Boy, oh boy, you've answered all these darn questions, Michelle. Let me ask you this question. Should other services such as community services, volunteering, be part of a probation period if that's indicated, or should they be used in a different way or used at all?
I think I use those things more than the average municipal judge in New Mexico. I use all different sorts of things like I mentioned earlier. I mean, people that are so scattered that they're going 15 miles per hour over the speed limit, they're struggling with what's happening in their day. And I do ask them to please go take a meditation class or a yoga class. Do traffic school. I prescribe traffic school a lot from the bench in terms of the traffic violations. And the detective in Corrales, Detective Colvin in Corrales, is actually going to start a traffic school for the village of Corrales.
Oh, great.
So our court is going to have, through the police department, our own traffic school very soon, which is a great thing.
That's great.
But traffic school tools that I've been giving out for the last 10 years are an online module of several hours where you get information about safe driving habits and all sorts of things. I give that to people quite a bit.
Yes.
I think that community service too is not only important because it helps the local community nonprofit food pantry or our animal control department or whatever agency I refer them to. It not only helps them, but that person gets to self-reflect. And whether I give them 2 hours or 6 hours of community service, I sometimes have people that come back and say, you know, I not only did the community service, but I'm going to keep working for that organization, which is always really wonderful.
Of course,
to know
giving
that,
back is a great thing. And if you can engender that in people, they grow.
yes,
People grow.
yes,
Okay. Okay, your biggest challenge when on the bench? I think you kind of talked about that too, but
right.
go for it.
So, kind of 2 layers probably. First, cases that have people with very complex perspectives or people that are very confused about the steps of the process, it really creates more of a time constraint on how can we get through this. So I have had traffic cases that can take an hour and a half on one very simple citation. And that's because there's a lot to manage. The person has a lot to say. They bring in witnesses, and that is their right.
Sure.
So making time in a traffic court that's kind of designed for very short kind of citations, kind of moving through them, can be a struggle. And so there's that. Then there's also the cases that involve a lot of motions, and sometimes the defendants, the people that are charged with a crime, actually file multiple motions. And when they file motions, I have to kind of figure out, especially if they don't have an attorney, I have to kind of figure out what is their goal and help them put sort it into where it belongs. Sure. For instance, they may make a motion that they think is a motion to dismiss, but it may be more in the characterization of a motion to exclude a piece of evidence. And so helping them sort through what it is that they're asking for and explaining to them what I think they're looking for and finding that out before I move forward is super important, and that will also make cases more complex and more time consuming.
So do you frequently go over your assigned time for behind the bench when you're in?
Well, we do our best to try to schedule on the mornings when I do have trials. We try to schedule not too many hearings. I won't do more than about 8 to 10 hearings on a morning for trials because I want to make sure that people have enough time.
Wow.
Yeah.
It sounds arduous. It sounds like it's arduous. So you had mentioned in your private practice that you see people who have a job, who are middle class people have a job, and that's socioeconomically in that segment of society. But in the traffic court, do you tend to see what populations do you see represented? I
would say that it's still primarily average folks with the house and the job and so forth.
They're distracted.
Although there is 5% maybe of homeless people that do come before the court. So I encounter them on kind of a regular basis. And some of those people are not homeless as we necessarily think of it. They're not people that are completely without other support. Many of them are couch surfing. They stay with one friend or another friend and go move from home to home. So their address is inconsistent. Some of the people are in a temporary situation because they haven't found another job. So helping them to make sure that they stay in contact with the court to update us as to where they are is super important so that they can avoid any bench warrants. But trying to help them also work through what they need to do immediately, because if they are truly homeless, their connection to the court will be really limited. So making sure that we try to make solutions that are very short in time and not drag it out too long.
Wow. Is there a social work department or something akin to that that's associated with the legal system in Corrales, for example?
Well, the municipal courts themselves don't necessarily have social workers, although can we refer people to other state and county services? Yes, absolutely. And so giving out resource information is another thing I do try to do, or I ask people, are you affiliated right now with a homeless shelter? Do you have a place that you are able to sort of get your anchor point, if we need to send you mail? All of these sorts of other services are out there, although, as we've kind of discussed, they're all very kind of separated and piecemeal, which makes it a lot more complex, that we don't have a broader system that sort of does all of the services in an integrated way. it makes it a lot harder for the homeless people.
Well, I remember studying Maslow's hierarchy of needs, and at the very base of support for all the other needs, that including administrative functioning, cognitive functioning, is housing. I mean, they have to have a place over their head, a roof over their heads, and some sort of protection from the elements, heating. I don't know. I think now air conditioning in terms of that, but something that protects them before you can go on to the next step, which is actually perhaps obeying the law. I don't know. I'm guessing on that, of course.
Right.
But if are there appropriate places you actually can refer and get results? Do those exist?
Well, so I don't get a lot of follow-up with the homeless population that come to the court because the tickets are so limited.
And you have
it may be a
access,
single citation for no registration or no insurance because they're driving somebody else's vehicle. So these are very limited contact opportunities.
Sure.
And so making sure that they're connected to some kind of resource, either through friends that assist them or through the local shelters, the Rock here in Albuquerque, St. Martin's Hospitality Center, St. Felix Pantry in Rio Rancho for food, all of these local locations to make sure that they have something that's going to assist them after the case is closed. But our cases close pretty quickly, so it's hard for me to know what their follow-up is.
Of course, and neither are you in the stream of feedback, if there is any, that occurs during that whole process.
Right.
You know, you see them sort of intermittently, but that's eye-opening. Because I know one of the problems, and that kind of opened my eyes to the issues at the very beginning of the problem with Dr. Goldstein. I'm citing her several times because she brought up some very germane issues that we all have to deal with. That if the system breaks down, it breaks down in little ways, and we may see it, for example, in the court, which is the result of a maladaptive behavior, if you will, or in medicine, a maladaptive response to a stimulus, which resulting in disease. But as far as where it actually starts or what you can do to correct the course of events that leads to those dysfunctions is always a question. And I think the focus has to be on there before we can really try to juggle all the issues that we have during extended dysfunctional periods.
Right.
Okay, I have a good question that was given to me just this morning. Based on your CV, you have a wealth of experience in substance abuse, and define substance abuse in terms of specific substances. You had mentioned this to me before, but I wanted you to explain it again.
Oh, sure. So in the context of criminal cases, substance abuse, substance use is any negative use of your own prescription medication or medication which you haven't been prescribed or an illegal drug or alcohol. The majority of the DWI work that I've done over 30 years has been primarily with alcohol. Marijuana is starting to come more into focus in terms of that, but marijuana is very hard to pin down in terms of a level which would be considered to be intoxicating, so that's complex, and that's something that the states, all the states who are legalizing, still have to work out. But the substance abuse that is seen in terms of our court system varies widely, right? From very chronic addictive use to people who use occasionally or use it even socially and end up in an unusual or uncomfortable situation with a crime. Yeah.
Well, that's interesting because certainly chronic abusers tend to develop a certain tolerance, I would expect, and can function on all cylinders, even when they're, for example, what comes to mind is someone who is a chronic alcoholic in the medical field, drinks every day, or however often. There's different kinds of theta, beta alcoholics, but drinks regularly enough to have a level of alcohol in the system at all times, but functions relatively well under societal influence and with behaviors that they function in their society, they function in their job, they function in their personal relationships. Tend to get a little tricky, but nonetheless, it's going to be hard to make those sorts of decisions when you're talking about silent kinds of substance abuse. And you mentioned when someone is taking their medication incorrectly, or taking their medication correctly and having side effects they're not reporting. Right. That's a big thing. I know I see that in medicine, certainly.
Well, and I don't see it very often, but I did represent a DWI while under the influence of a sleep aid. a prescription sleep aid that had been given to someone, and they were not aware that this particular medication had the potential for sleepwalking.
Right.
But this person was not aware of what was happening to them until the cuffs were going on. And how, getting the keys in your hand, getting behind the wheel, and driving up the street. There's a lot going on in there, and being really self-aware of how your medications impact you is so important.
Well, I think this is, I'm glad you're bringing this up, because one of the issues I feel is that the discussion I had just this morning with someone who had been taking a medication for memory loss and was experiencing a lot of side effects, and I encouraged her to call her primary care. And she said, oh no, but they talk about these side effects. It's like, yes, they talk about them, but when they impair your functioning, you have to be in connectivity with the person who prescribed them, because they don't know what you're experiencing. And there may be another medication they could use instead, or eliminate that one. But that's something that the responsibility rests with the person who's experiencing the side effects. And a lot of times they are so cowed by the overwhelming mystery of medicine and mystery of medications that they don't know to complain, and of course it's always hard to get hold of somebody too, but still.
Well, and that's why both in my private practice and occasionally in the Corrales municipal court dockets, when I talk with someone who is experiencing a lot of struggle with the need for some kind of therapeutic work, and it appears that they have very deep anxiety issues or very deep depression issues. And I am not a therapist by any stretch, but when they talk to you about how their struggles seem to be framed around these things, I always suggest you need to be seeing someone every single week to talk to them about what has happened this week. Are my medications working well for me? If they're not working well, describing what's happening. And many people are getting that script for the anxiety or the depression from their GP.
Yeah.
Or they may have a psychiatrist or psychologist, but they may see them maybe once a month.
Sure.
Well, between 0 days of the month and 30, there's a lot of time in there. Right. And that is just not enough therapeutic support to identify how is this medication helping me or not helping me, and identify those things really quickly. And so I'm really focused on making sure that I tell people, if you're on a specific medication or you think you might need it, make sure you have both levels of care, the prescriber and that regular therapeutic work, because those things tied together are what will create success.
I think that's an excellent point. If only there were so many services that they could call on. That's what I feel the stress when I talk about that is, we are so lacking in having the accessibility to these things. And that's just, I don't think it's just here. I do believe it's global, but or universal, at least for this culture. Okay, what measures have been established? What measures have been established as constituting dysfunctional behavior that can be associated with substance abuse?
Repeat the question for me.
What measures have been, it's always scary when you have a lawyer ask you to repeat a question. Okay, define substance abuse in terms of specific substances, which you did, and then what measures have been established as constituting dysfunctional behaviors that can be associated with substance abuse?
Wow, that's a really big question. I think that for some people, they may be involved in a criminal case, but whatever's going on for their behavior may have been single instance of something happening in their life. For instance, a significant grief event in terms of a loss of a close family member or someone close to them, and they might not have any long-term sorts of indicators of difficulties. Whereas the package for people who have more substantial need for diagnoses are probably the ones that everybody wants to point to say, this is the behavior that we think is bad and that we have to punish. And they're different scales. And it's so important when we get to the second layer of the case. You know, anybody could be charged with DWI or with possession of substances that they shouldn't have, whatever it is. But how did they get there? Was it some sort of
erratic driving, or was it hitting, God forbid, hitting a pedestrian? That makes my heart go pitter-pat for a second.
Right.
But some sort of behavior is what have to be pinpointed as being, there's a problem here, let's look further.
Right. And so addressing the facts of the case is obviously the first threshold. What are the facts that led this person to this situation? But then behind that, the sentencing remedy really needs to match up to what is our real circumstance here, and have we got enough information to be able to say this behavior came from this baseline. I mean, but the number of behaviors are like the stars. It's hard to sort of pinpoint a particular category, I suppose. Most of it is driving behaviors. I mean, I'd say
Sure, that's what's obvious.
Yeah, right.
The
Well, it's
obvious
also
thing.
the easiest place for law enforcement to identify people in the problem, right, in the moment.
Sure,
Yeah.
sure. Yeah, that would make sense, that is the red flag that brings everything, culminates in an arrest or a citation or whatever the case may be. But it sounds like you have to almost do forensic law to kind of
yes.
figure it out. Let's sort
Yes.
this all out, you know?
Right. Well, and I feel like my role is so important when I'm an advocate for a client who's the defendant. It's so important for me to tell their story.
Yes.
And whether I get the opportunity to do that in defense in a trial, or whether I get the opportunity to do that in the sentencing framework, it is the cornerstone of getting them to the right place.
Oh, very good point. So that you've succeeded in targeting the germane part of this whole interaction that you want to result in a positive outcome.
Right.
Wow, it gets complex. My hat's off to you, Michelle.
Thank you.
Okay, so we have the objective measures, of course, of blood alcohol level, but this becomes a more esoteric kind of a question. And okay, so let me I'm fascinated. Let me get to the point where I really want to talk to you about is what are the 2 tips that you would say, that you would like to say to our audience of what is the important facts that you would like to give them to make their health better? And there you go, girl.
Evaluating where we are in our lives is so important. Whether it's a number of different traffic violations that we've experienced over a short period of time, and it just seems to be a little flag that says, what's going on, because this isn't my usual life pattern, or whether it's something more significant, getting a DWI, having a domestic violence battery case, having possession of drugs or marijuana case that's more significant such that I've been charged with a crime. Any of these things have to be a signal that we have something that we can address for ourselves, that there's something happening that we need to take time to evaluate and step back from what's happening in the case and the facts of the case to figure out where we are as people. And then from there, make that proactive step. Take the time to make those phone calls. And it's so hard for people. There's providers out there, but those providers are so overworked and so busy. And we want the system to be able to support the need. But making sure that you make the phone calls until you find that that provider that's going to help you to sort of untangle what is going on. If you don't take that proactive step after you kind of self-evaluate and say there may be something happening here, then you're never going to really answer it, and you just may end up back in that cycle.
And that mare's nest
Yes.
of dysfunction.
Yes.
That is very, so identify the problem and do something about it.
Yes, that's right. That's a simple way of saying it.
Oh,
yes.
great. Okay. Well, I think that's probably, I know that there's so many more questions, but we're so pleased to be able to bring this to you, and thank you so very much, Honorable Michelle Frehette.
Thank you. Thanks so much.
And thank you so much for our viewers to tune in to us, and we're so happy to be able to bring these to you. Please look at us on YouTube podcasts of Hear4Health podcasts, as well as Hear4HealthNM.com. That is our web, our URL, and we have information there for you as well. Thank you so much. Goodbye, and thank you for listening to Hear4Health.